Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Causes of restrictive lung diseases. So, in the restrictive lung diseases, we have two different causes. One, we have intrinsic restrictive lung diseases. We have one intrinsic or restrictive lung diseases, which are also called as parenchymatous restrictive lung diseases. In intrinsic restrictive lung diseases, mainly it includes the sarcoidosis, idiopathic pulmonary fibrosis, pneumoconiosis, and also some drugs can result in intrinsic lung diseases, then radiation, acute respiratory distress syndrome. All these are responsible for intrinsic restrictive lung diseases. Then we have extrinsic restrictive lung diseases. In extrinsic restrictive lung diseases, these are also extrinsic lung diseases, but these are mainly extraparenchymal. Here these mainly involve the chest wall, disorders of chest wall, or muscular or neurological weakness, like in Guillain-Barré syndrome, where there is myopathy, where the patient finds difficult to expand the airway because of the muscle weakness, whereas in myasthenia gravis, diaphragmatic paralysis, kyphosis, obesity, and ankylosing spondylitis. So, all these are the extrinsic restrictive lung diseases.
thank you and thank you for watching.